Hello guys, welcome back to my YouTube channel. My name is Nas Denny. So if this is your first time watching my videos, remember to subscribe in order to be part of this family. It costs you nothing guys to hit that subscription button, so I'll be very happy and appreciative. So today I want to talk about very common illness on urinary tract infection. I'll be telling you what urinary tract infection is, the causes, signs and symptoms, risk factors, how you can treat it, and most importantly, prevention of urinary tract infection. So stay tuned to the end, and remember to leave a comment there in case you have something you need to inquire. Kindly just reach me through the comment. I'll respond back. So welcome guys. So I have a chart here that will enable me to explain to you well about the condition. So urinary tract infection is simply the infection of the urinary system. A urinary system comprises of this simple organ. That is, we have two kidneys, the left kidney and the right kidney. Kidney is a bean-shaped organ, as you can see in the chart, which is 10 centimeters long and 5 centimeters wide. It is approximately the size of your fist. So from the kidneys, we have this tube here. The left one and the right one, they are known as ureters. So ureters drains urine into a sac called the bladder. So in this sac, you can see these circles have made here the valves that prevents the backflow of urine once it is emptied into the bladder. And then from the bladder, we have this outlet called the urethra. So the urethra is the passageway that removes urine out from the bladder. So I will categorize the urinary system into two. That is upper urinary tract infection and the lower urinary tract infection. So the upper urinary tract infection is the infection of this part from the bladder here, from here up this part upwards. That is the infection of the ureters and the infection of the kidneys. So infection of the kidneys is known as pyelonephritis. That one is the infection of the kidneys, and then the infection of the ureters is known as ureteritis. So that is the upper urinary tract infection. And then the infection of the lower urinary tract infection comprises of the infection of the bladder, urethra. So infection of the bladder is known as cystitis, you can see. Then infection of the urethra is known as ureteritis. You can see here we also have added prostatitis because prostate gland is just part of this. Beside the urethra, we have the prostate gland located there. So what causes urinary tract infection? We have different pathogens that causes the UTI, but the main cause here is the E. coli, which causes 90% of the UTI. So E. coli is from the digestive system. We have other causes, other causative organisms like the Klebsiella pneumoniae, the Candida species, Enterobacteriae, and the Proteus species. So but the main, I've said, is the E. coli, which causes more than 90% of the UTI cases we have. So normally human beings, they have secretory defense that helps in fight of the pathogens that can cause UTI. So in females, we have some organisms called the vaginal flora, and the most common vaginal flora found is lactobacilli. So this lactobacilli, it helps in fighting the organisms, so it will help you prevent the infection, urinary tract infection, from coming in. Also in males, we have other organisms that are produced to assist in prevention of UTI. The physiology of UTI, how does a UTI come in? The first point here is contamination. So when you get into contact with, for example, the E. coli. E. coli, I said it is from the gastrointestinal tract system. So when you come into contact with the E. coli from either infected urine or fecal matter. Mostly we get it in a toilet. So mostly, for example, ladies, when you use same toilet, so many people, and one of you is infected, others can also get infected through coming into contact with the E. coli, which is either from the fecal matter or the infected urine into the urethra and finally the bladder. So when they have entered in, they colonize the area, the bladder, and then normally after colonization with the pathogen, there's an inflammatory response by the body, which includes the infiltration with the neutrophils. So generally, when a strange organism enters the body, there's immune response that is done by neutrophil infiltration. So these bacteria, they have virulence factors that enable them to survive the immune response. So once they've invaded the bladder, they have their adherence factors. You can see here, they have adherence factors. So they adhere to the walls of the membranes of the bladder, and then they multiply once they have entered into the bladder. So they have resistance to the immune system that is produced as a defense. So they are resistant to host immune defense, and therefore they are able to survive and multiply and cause urinary tract infection. So from here, when they have colonized and you are not treated of UTI, they have the capability of ascending upwards to the ureters, upward until they reach the kidneys. And therefore, you also in the kidneys, we also have a blood supply from the renal artery and the renal vein. They can move into the circulation and cause further infection. Risk factors of UTI, one of them is catheterization. So catheterization is simply the insertion of catheter, urinary catheter, into the bladder to help in removal of urine for those who are not able to pass urine normally. This one is done in a hospital setup. The procedure of catheterization is aseptic. It is done, the hygienic factors must be adhered to prevent the introduction of microorganisms into the urinary system. Second factor here is pregnancy. Pregnant women at high risk of contracting UTI. One of the main reasons is because of the low immunity they have. Another one is because of the hormone progesterone, which relaxes the smooth muscles of the bladder that can enhance retention of urine or urine stasis. So when you have urine stasis, you promote colonization by the microorganisms. And also another factor here is being female. So pregnant women, there's also this factor of being female that is also connected with my point number 2. So being female are at higher risk than male because of the anatomic difference. So they have shorter urethra compared to males. So having shorter urethra, microorganism can easily travel to the bladder and cause urinary tract infection. So the fourth point here is sexual intercourse. So sexual intercourse promotes the introduction of microorganisms into the urinary system. Another point here in this is the hygienic factors. So most people, when they engage in sexual intercourse, they use their hands in the process of foreplay. So when you don't observe hygiene in your hands, you can also introduce microorganisms into the urinary system and cause UTI. My fifth point here is menopause, stroke birth control. So all these factors, they lead to hormonal changes in our body. So at menopause, we will have those changes that will influence your vaginal flora. So the change in vaginal flora will kill these important microorganisms that assist in prevention of UTI. The sixth point here is blockage. So blockage comes into these positions. We have when you have enlarged prostate gland and also the kidney stones. So earlier I said that we have in the urethra, along the urethra we have prostate glands. So when you have enlarged prostate glands, they squeeze the urethra, and therefore it will prevent the urine outflow. Therefore, you will have stasis of urine in the bladder. I've said that when you have stasis of urine, you promote colonization by microorganisms, and therefore you will develop UTI. The second blockage factor there is kidney stones. So kidney stones are just their minerals that are deposited in the kidneys. When you have kidney stone, they will prevent the outflow of urine from the kidneys, and therefore that retention of urine in the kidneys will promote growth of microorganisms and cause urinary tract infection. My seventh point here is having low immunity. For you to be healthy, you need to have a good immune system that helps you fight microorganisms. So in this point, when you have low immunity, the immune response to fight the microorganisms, that is the E. coli for example, will be ineffective. So people who have low immunity, they are at high risk of developing infection, including UTI. The eighth point here is antibiotics. So this factor here, you need to put a star. Many people nowadays abuse antibiotics. You need to understand that these antibiotics, some of them have the capability of killing the flora, the normal flora, which helps you to prevent infections. So abuse of antibiotics will increase your risk of developing UTI because of the killing of the normal flora, or for example the lactobacilli in the vagina. The number ninth point here is diabetes. So remember, the diabetic patient, they have sugar in the urine. So sugary content, you need to understand sugary content promotes the growth of bacteria. So when you are diabetes, you are also at high risk of developing UTI. Signs and symptoms of UTI. How do you know that you are infected with UTI? I said we have that urinary tract infection, that is the infection on the upper part of the urinary system, and the lower part. So let's start with the upper part. So you will have a feeling of back pain or flank pain. Flank pain is just below your ribcage, just below your ribcage where the kidneys are located. You also present with fever, high fever, nausea and vomiting, and also signs of shock. So in the lower UTI, we will present with the following. So you'll have cloud urine, which has offensive smell. This is because of the pus cells and also the white blood cells in the urine. Another one is having burning sensation while with the urination. Persistent need to void. So these people will have you'll have the persistent need to urinate. So when you try, you will either have a small amount or you can't urinate, but you have the urge. And then dysuria. Dysuria is just painful urination. During urination, you will feel that pain. And then also lower abdominal discomfort. You also present with hematuria, so you can observe some blood stains in urine. And finally, discharge. So when you have discharge, there are also other tests that you have to that must be done to rule out other sexually transmitted infections, because you know most UTI is also present with discharge. And then in older patients, these old people might not have typical symptoms of UTI, but they can present with the behavioral changes. So you'll find that most of them are confused, they have increased risk of falling, and also the increased urge to urinate. So if you have an elderly person, please be keen and observe. They can present with these symptoms. They are not the typical ones, but when they present with these ones, you should suspect for UTI. So diagnosis of UTI, the first one is urinalysis. So as a nurse, you have a role in collection of urine. So you can either collect it yourself or teach the client how to collect to prevent or minimize the risk of contaminating the urine to avoid false results. The second one is doing a urine culture. This one will help you to identify the specific causative organism. And then also you can do a cystoscopy. This one is imaging to check on the blood or urethra if there are other structural problems inside. How do we treat UTI? So we have the lower UTI. The lower UTI are treated by using oral antibiotics. You can do 3 to 7 day dose of empirical antibiotics. So these are the examples of empirical antibiotics: the amoxicillin, trimethoprim, nitrofurantoin, sulfonamides, and others. And then the upper UTI, you know, is a serious infection. So you normally treat it with intravenous antibiotics. And since these patients also have pain, you do pain management. Finally, prevention of UTI. You know, prevention is better than cure. So I have 8 preventive measures that will help you minimize the risk of getting UTI. The first one is drink more water daily. That is 2 to 3 liters per day. This one will help you to clear your urinary system and also dilute the urine. Second one is wipe from front to back. Mostly ladies, when you wipe from front to back, you minimize contaminating your vagina or the urinary system with the microorganism. The third point is void after intercourse. One of the risk factors was sex. So when you void after intercourse, you help clear the urinary system. Avoid tight underwears that will promote contamination with the microorganisms. Fifth one is frequent changes of pads. During your menses as a lady, frequently change your pads. Empty bladder regularly, 2 to 3 hours. I discourage people staying for long without urinating, because when your bladder is full and you don't empty it, you will promote growth of microorganisms. The seventh one is complete treatment with antibiotics. When you've started treatment with antibiotics, ensure you complete the dose so that you avoid developing resistance. And the last one is avoid irritating feminine products. So things like perfumes, avoid them because these products, they can change your vaginal flora. So when you change they can change the pH of vaginal flora and kill those important microorganisms that help you fight the infection. Yes guys, that is the end of my presentation. I want to thank you for being part of it from the beginning to the end. Give me a like. Don't forget to leave a comment in case you have a question. Put it in the comment section, I'll respond. And also I'm encouraging you guys to continue subscribing to my channel. I'm towards 1,000 subscribers. I'm at 400, so your support is very, very important. I appreciate for everything you've done for me since the beginning of this channel. Thank you guys.